19 August 2016. And it just now is 14 years old, yeah. Has this swelling under the, then here, submandibular swelling, this side and to this side. Okay, so now we need to take X-ray to check what's the cause of the swelling. It could be a sublingual.
This is a Be Kind to Pets veterinary education video sponsored by Payoh Vets, where veterinary medicine and surgery come alive to vet students and pet owners. This video is a case study of a dog with neck abscess. Firstly, let's understand what exactly is neck abscess. A neck abscess is a swollen area containing pus accumulation around the neck of the dog. It can be caused by bacterial, fungal, parasitic, or other reasons. Next, let's take a look at the history of this case. The owner reports that the symptoms have been present for 3 days, but the infection is suspected to have lasted for 10. Let's take a look at how we diagnose this case through blood tests and an X-ray. Firstly, blood tests. For bacterial infections, both the total white blood cell count and the neutrophil count should go up. But for viral infections, the opposite is true. From this table, you can see that this neck abscess is clearly caused by a bacterial infection. We first take an X-ray of the mini Schnauzer, and it shows us that the esophagus, barely visible, is constricted, and this could explain its inability to eat, while the trachea has also been pushed down, which causes its panting and difficulty in breathing. Next, let's take a look at how we treated this dog. Firstly, an incision was made on 19th August 2016 to allow the pus from the neck abscess to be drained out. Next, the dog was given an intravenous drip and then a subcutaneous drip. An IV drip was used at first as it has a faster effect as it does not have to pass through fats and muscles. We dripped it with sodium chloride and Hartmann solutions. Next, let's take a look at the discharge of the dog on 22nd August 2016. Unfortunately, the dog was still unable to stand, but its rectal temperature has returned to a normal 38.9 degrees Celsius. We also see that it has a healthy pink color in its tongue, showing us that it has recovered.
Yeah. You see the cut? Okay, it close already. 这个龙这边龙拿出来就是这边咯。它就
Next, let's take a look at the nursing care involved after the dog returns home. Firstly, because the dog is unable to eat on its own, a syringe containing the food or medicine has to be inserted at the side of its mouth. Next, the neck of the dog has to be stroked in order to help it swallow the food or medicine. The tongue is rubbed and disturbed, and the purpose is also to help it fully swallow the food or medicine.
如果它自己会喝，就给它喝了，不过现在不可以了。
哦，现在不可以啦，
A bit more. Sometimes you disturb the tongue 嘛，如果你弄它的。
This process has to be repeated until all the food and medicine has been completely fed to the dog.
就说你 syrup
早上吃啦。
也可以，一天一次。
哦，一天一次啦。
这个 the throat 咯。这个 the throat 呢，你吞了呢，你就swallow 了，这个 the throat 咯。There are a lot of things to give 还要慢慢等一等 ，OK finish.
The dog was prescribed with antibiotics, multivitamins, lactate, Metacam, which is a painkiller, and AD canned food. It also has to rest on its chest as it cannot balance on by itself. Conclusion. This dog was hospitalized for 3 days in total, and after these 3 days, we saw that the swelling in his neck has significantly reduced, telling us that the treatment was likely successful. However, there's still one more step, which is nursing care at home. It is important to follow instructions diligently and accurately if your vet requires your pet to be nursed at home. For more information, you may email the following address or call the following hotlines, managed by Payoh Vets.